The Med Lab and the Computer-Assisted Otologic Surgery Lab at Vanderbilt Medical Center are developing a surgical robot for inner ear surgery. The first step in most inner ear surgeries is to gain access by drilling a pocket in the knob of bone behind the ear known as the mastoid. Since many vital anatomical structures are embedded in the bone, an image-guided robot has the potential to make the procedure not only faster, but also safer. We began this project several years ago using an industrial robot tracked by optical cameras. Here, the robot is drilling a precise pocket in the bone that corresponds to the volume the surgeon wishes to remove. Recently, due to the desire for a simpler system with very high accuracy, we have designed a robot that can be mounted rigidly to the patient's head. The prototype shown is a 4-axis robot with 3 translational joints and 1 rotational joint, actuated by piezoelectric and brushless DC motors. The surgery is planned based on automatic and manual segmentations in the preoperative CT scan. In the operating room, a positioning frame containing 3 titanium spheres as fiducial markers is fixed to the patient's skull, and a CT scan of the patient and positioning frame is then acquired. The preoperative segmentations are transformed to the intraoperative CT scan, and a safe and efficient milling path for the robot is calculated using a custom algorithm. To ensure safety, we use a statistical approach to account for the small errors associated with registering the plan and the robot to the patient, which enables us to reliably avoid critical structures such as the facial nerve. We also optimize the drill angle to minimize drilling forces and make the procedure more efficient. The robot locks to the 3 titanium spheres on the positioning frame, aligning the robot with the patient's anatomy. To date, we have achieved successful results in cadaver studies and are working towards refining various components of the system in preparation for in vivo experiments. This research is supported by the Vanderbilt Institute for Clinical and Translational Research and the National Institute on Deafness and Other Communication Disorders of the NIH.